Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome. Hi, everyone. Welcome to the next episode of Power Up Recovery with Nutrition, where we look about how to use nutrition, whether it be through food, amino acid therapy, other supplements, anything that feeds the brain what the brain requires to function optimally, repair itself, and allow you to overcome mental health challenges and addictive disorders. Today, I'm delighted to talk with an old friend of mine, Dr. Hyla Cass, who my understanding is one of the first integrative psychiatrists in the country. And she's going to be speaking at our conference coming up in a couple of weeks on the use of amino acids and other nutrients to address insomnia, which is a huge issue in early recovery, as well as a number of other really fascinating topics. So I can't wait to get into it. Welcome.
Happy to be here.
So, can you tell us just a little bit about your history, how you got to be here today, and what your passion is?
Well, very early on, I was a kid and I was a doctor's kid. And the whole idea of practicing medicine and helping people get better was very ingrained in me. I was going to do what my dad did. I was going to be like him. There were three other girls in the family. None of them had the least interest. And to me, it was like, this is the way it's supposed to be. So I was going to go into some sort of health field. I wasn't sure which, but my father strongly encouraged me to study medicine at a time when women were not doing it. Now, more probably at least 50% of the class of medical school are women, but not so then. So I did, and it's true that women in those days required a male mentor to actually succeed, like getting into medical, all of that. And I got in, he had been an alumnus at the University of Toronto, so that gave me a bit of a leg up, even though I was a woman, and they didn't really want to have women because they figured they'd drop out and have kids. But I did, and I liked it. I decided to study psychiatry because I wanted to find out what makes people tick. It always just fascinated me. So then fast forward to residency, where I was actually in a fairly psychodynamically oriented program that was not all meds. Some of the other programs like UCLA were very heavily, into meds there weren't that many of them then, but they had a lot of side effects, and we were really more psychodynamically oriented, and that stuck with me. And
that's lovely.
Yeah, what I always saw was that meds had side effects, and they didn't always have the positive effect that they were supposed to have. And I didn't really get it. I didn't understand about the pharmaceutical, industrial, medical complex.
Which had only just started getting going. It hadn't even moved into its full power yet.
That's true. But it was happening. Doctors were being wined and dined by the pharmaceutical reps. And
Right.
I just never stuck with me because I
Mhm.
saw how psychodynamic psychotherapy was so powerful.
Yes.
It worked. And then fast forward, I don't know, a little bit after my residency finished, I discovered nutrition
Mhm.
and saw that,
How? How did you discover nutrition and mental health?
well, it's interesting. One of my colleagues, who was a year ahead of me in the residency, was attending the pain clinic at UCLA, and they were introducing things like sugar and lowering sugar and how it made a difference in people's mood.
Mhm.
There was this whole, sugar mood connection that I had never thought of.
Right.
And and then I began to notice it in my practice, like, oh,
Uh-huh.
people are eating is affecting their mood. And
Yes.
if we vary the intake, particularly sugar and simple carbs, the better people felt. So
Mhm.
rather than just going right for the prescription pad, see what people are eating. And then I got introduced to people like Abram Hoffer,
Mhm.
some of the old greats. I was
Yeah.
fortunate.
The beginning of the orthomolecular psychiatry movement.
Right. And I used to attend the orthomolecular meetings, and they had
Mhm.
a whole different approach. I mean, bless him, Abram Hoffer was, quote, curing chronic schizophrenics, getting them out of the back wards with niacin and vitamin C. Like, really?
Yeah. 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 And in fact, we have somebody from the Orthomolecular Society speaking on niacin at the conference, Dr. Cheng.
Right. And he's done a lot of work with vitamin C as well.
Yeah.
So, in fact, vitamin C and COVID. So this is, it still works. But
Yeah.
nowadays, we have a lot more going on. We have all kinds of toxins, including invisible toxins like EMFs,
Mhm.
and all kinds of energetic interference with us because we're energetic electrical beings, and all these things are
That's right.
impinging on us.
That's
And
right.
the standard American diet, which is hideous.
Mhm.
So,
Mhm.
what to say? So I think,
Well, it's hideous because it's not providing us with the nutrients that our bodies need, but that our brains need to make neurotransmitters, transmit neurotransmitters, and function.
yeah,
We've got starving brains.
yeah, it's kind of crazy, isn't it? I mean, we have a natural pharmacy inside us
We do.
where all the we intake, say, protein, carbs, fats, and they get turned into us, into our physical being,
Isn't
into
that
our
cool?
bodies, into our
That's so cool.
neurotransmitters, into our brain cells. And
Yeah.
if it's garbage in, garbage out, you put in garbage, you're not going to have a healthy body.
No. Or a healthy brain or healthy mood.
Right. So
Yes.
I began realizing this quite early on. I've been in practice at this point for over 40 years. So it's been a long time. But what's interesting is that it's caught on to some extent. We now have functional medicine, which we didn't have in the
Mhm.
old days.
Mhm.
We have naturopathic medical schools. I mean, there is a lot more going on than there was, and
Right.
yet there's a vast mainstream that's really uninformed about all this. And so it's very important. The work you do, Christina, is so important. Going into the communities and dealing with using food as medicine,
Mhm.
because that's what it is. Or that food is medicine. Medicine is not medicine. Medicine actually suppresses symptoms and is not adding anything. It's not giving you the nourishment you need for things to work. And in fact, often there's side effects and negative effects, addiction, dependency. So you get into a really slippery slope.
Well, and that's why I finally went ahead and wrote a book. People have been telling me forever that I needed to write a book to get this information out there more effectively. And so this will be released just before the conference. Eat And then the subtitle is A Guide to Radiant Recovery Using Food and Amino Acids to Repair the Addicted Brain and Reduce Cravings.
Amen. And it's
Amen.
beautifully done. I mean, the illustrations are very, they're pretty, they're colorful, they're illustrative of what they're talking about, and they break it up. So
Hmm.
the book is like a really easy read, even though it's very serious information. It's it's easy to absorb. It's light. You can come at it from being an expert. I mean, I'm an expert, but I'm reading it's like, oh yeah, this is good. It organizes my thoughts about it. It reminds me of things. And then for someone who's uninitiated, it's not like it's not complicated. And it works
Exactly.
wise. And
And
it
it's fun.
they are. It's fun. It's cute.
Yeah.
And you're learning at the same time.
Well, I wanted to produce something that nobody else has ever produced that shares this information in a really easily absorbable, bite by bite fashion that people are going to enjoy reading and enjoy sharing.
And can go keep going back to.
Yeah. Yeah.
It's very much a reference. So you can look at the section. I spent some time on the section on sleep because that's what I'm going to be talking about. And it was reminding me of certain things. And
Hmm.
there's things like the circadian rhythm that we have to look at, sleep hygiene, things not to do to sleep,
That's
because
right.
I'm going to
That's
be
right.
covering in at the conference, and I'm so excited about that.
Yeah. So why don't you tell us a little bit about what you're going to be talking about at the conference? I know I asked you to talk about sleep because insomnia is such a huge issue for people in early recovery and later recovery and our lives.
Yes, for sure. Now, what goes on in recovery is people are coming off substances. They're already not probably not sleeping before, or they were using their addictive
That's right.
substance to help them to sleep. Their circadian rhythm is totally gone. They don't have their natural pattern back, or if they ever did
Hmm.
have it, and they're depleted
That's
because
right.
they haven't been eating well. So they don't have the raw materials to make the neurotransmitters
Oh.
we need to operate. They've been eating empty calories. And what I'm going to be doing, what you have been doing all along, is educating people about how to restore good sleep. And people in recovery are certainly at a disadvantage. The other problem, big problem, is if they've been in any kind of recovery program, inpatient, outpatient, whatever,
Mm.
they've been given what's called MAT. It's such a harmless little word, MAT. Well, it's medically assisted therapy. It's drugs. So these people are coming off drugs,
That's right.
substances of abuse, and they're being put
Hmm.
on other drugs. And I don't know the difference actually. And this sounds
That's
like,
right.
except that one's written and one's a prescription and one isn't. But the truth is they both cause brain changes. They both are really hard to get off of.
Hmm. Very dependency forming.
And the really bad thing is that they may go in with one substance of abuse and they come out on five drugs. And this infuriates me because they're coming to me, they've paid a fortune for their recovery program. And what did they buy? They're off their substance, maybe, probably, and they're on
Not always.
anywhere from 1 to 5 new substances of abuse called prescription medications.
That's right. None of which feed the brain what the brain needs to repair itself and function optimally. None of which get down to what the root problem is of the dis-ease that led people into substance use in the first place. And they create more imbalance in the brain and more toxicity. Now, I have seen, I mean, we do have to be fair. There are the situations where these meds can help people over humps because the doctors don't have the tools we have. And so this can help people over humps. It can, I've seen this get people off the streets and save lives. And I'm very happy for people to be off the streets and have their lives saved. The thing is that we can do this with what I called NAT, nutrition assisted therapy, that actually feeds the brain and gives people a solid foundation for recovery.
Thank you. Now, this is interesting. Now, I'm a psychiatrist, just to be really clear. I can
Yes, you
write
are.
prescriptions.
For
And
a really long time.
yeah, for a really long time. And and this is what psychiatrists do. They write prescriptions, and I'm known as the non-drug psychiatrist.
That's
And
right.
what's interesting is years ago when I started to use nutrition instead of meds, a therapist would send their patient to me because they weren't progressing in therapy. And
Right.
I would suggest to them, how about let's try some diet and some nutrients? And they say, no, no, I have a clinical depression. My therapist sent me for medication. I mean, I have a real depression. I have a clinical. I said, do us both a favor. Suspend disbelief and try this.
That's right.
So rather than
That's
giving
right.
them a prescription for Prozac, and this was in the days when it was mostly just Prozac and Zoloft, Paxil, and those are SSRI antidepressants. So rather than those, I would give them precursors. These are supposed to raise serotonin. Well, I would give them precursors to serotonin, which are tryptophan or 5-HTP, depending on which one they would respond better to, together with cofactors. It's like baking a cake, make
Right. Right. A
trans.
little bit of this and a little bit of that. Yeah.
Yeah, you need to have, the B vitamins, magnesium, enough with a good brain cell, essential fatty acids to make the cell wall. So
Mhm.
it's really a whole cocktail or
That's right.
uh, baking a cake. And by doing that, the person would actually start to feel better. And it always worked faster than an antidepressant because they may take a couple of weeks to start working, maybe longer,
That's right. That's
because
right.
they're trying to fool the brain. Well, rather than fool the brain, how about if we feed the brain?
That's right. Because feeding the brain actually starts working within minutes, in my experience.
Right.
Because once the brain gets those nutrients it needs, it starts using them and starts functioning better immediately. And that's the wonder of amino acid and nutrient therapy is, among other things, the speed at which it works. But Hyla, I went to school to be a psychotherapist 40 years ago, and I was taught, and therapists are being taught this today, that if you think your client has a biochemical issue, if it's a clinical depression, if it's due to out of balance brain chemistry because they're not responding to therapy, and there's lots of other reasons why people may not respond to a particular therapy, by the way. We were taught send your client to a psychiatrist to be put on medication. And it's still happening today, in spite of all the research done around using nutrients to reduce, the whole food mood connection and using nutrients to reduce psychiatric issues.
Yeah, unless people have actually seen it, it's hard for them to understand, hard to believe. And
Yeah.
well, the pharmaceutical lobby is very powerful. It runs
And it has a lot of
television,
money.
runs media. So it's a big lobby to go up against. So people are pretty much brainwashed. And it's only through firsthand experience, like knowing someone who has had success or really trusting a therapist who's telling them, instead of meds, I'm going to send you to someone with for nutrition. So, I mean, I have one guy, this is so cool. I have this one hypnotherapist who told his client, he said, I can't treat you anymore until you go see, and he sent designated me. He said, you have to see her. She's the only one who's going to save you at this point. And he, the guy, well, no, I don't know. So he did come to me. And
Uh-huh.
a week into trialing the first week, he said, oh, well, I can't take my amino acids because I'm still using. He didn't get it. I guess I hadn't explained it well enough. I said, no, no, the point is that we're going to add in the nutrients, and they're
Mhm.
going to help stop the cravings, build up your neurotransmitter stores, and it's going to change your brain and you're going to feel better. Oh, okay.
Mhm.
So he did that. And night two of using, I think it was L-tryptophan, using L-tryptophan, 1,000 milligrams, he said, I slept like a baby. I slept for 8 hours. I haven't done that in the longest time. He said, I'm a
Uh-huh.
believer. I'm so happy. I woke up. It felt good. Now, this is good. This is good. Not everyone responds that quickly and that well, but can you see? It's like his therapist sent him to me, and we did this, and he's going to be off and running.
Yes. And he's so lucky to have found you rather than having been put on other medication.
Yeah. And in fact, he is still on a small amount of a benzo that was
Okay.
left over from his last recovery program. So there's always that little, half a Xanax and, half a zero point 0.5 milligrams of Xanax or of Ativan or Klonopin. And that's that little bit that's really hard to deal with.
It is. And it's very hard to get off. People say, well, there's not so much. It's not very much. And I think, yeah, it actually is in terms of what it's still doing to your brain.
Yeah. So there are
And you
different
can't cold
ways.
turkey off it.
You can't cold turkey. I try to get it in liquid form and
Mhm.
often drops.
Oh, that's a good idea.
You know,
That's a
some
good
people
idea.
some people do it every other day, and that works for them. I never thought that was such a good choice.
Yeah, it doesn't work for my clients because then they're in withdrawal that in between day. A lot of my clients will dissolve it in water and then, throw away 10% the first week every day and then 20% of the water the next day, week, and, so forth. And that works as well. But if you can get a psychiatrist on board with you to prescribe the liquid, that makes life so much easier.
Yeah, and they don't all come in liquid. Sometimes you just have to, as you said, dissolve the
Mhm.
capsule. And sometimes they're in tablets and they don't dissolve as
No.
well. So all these various things to deal with. But boy, the psychiatrists sure love those benzos. When I was in my residency, they taught us that benzos were at most to be prescribed for 2 weeks because they're highly addictive. Oh,
What year was that, Hyla?
it was in the 70s.
I don't want to date you or anything,
Well, we
but I
did. It was in the 70s, and this is 50 years later.
it
But
is 50 years later.
without not very long after, I was seeing a lot of benzo use.
That's right. Valium especially.
Valium, yep, big time.
What did they call it? Mother's little helper.
Was Valium Mother's or was Librium Mother's little helper? I don't know.
I think it was Valium. Yeah. Now I hand theanine, to the mothers. When you pick up your kids from school, take a theanine or take some chewable GABA,
Or a
which of course
combination.
feeds the brain rather than, numbing you out
And addicting you. See, the
and
good news
addicting
is
you.
you don't get addicted to the amino acids because it's like food. You're not addicted to something that is nourishing and good for you. Yes, you can get addicted to food, but what you're getting addicted to is, say, refined carbs.
As a is
That's an addiction.
specific foods that the body uses as drugs. But yes, amino acids are anti-addictive because they're rebuilding your neurotransmitter systems rather than depleting them. And so over time, you get to take less and less to get the same effect rather than more and more.
And people learn. This is so nice. This empowers people rather than being given a prescription, being told, take
That's right.
one a day or two a day or whatever. They're given the products to trial.
Hmm.
And I tell them this is to empower you.
That's right.
I remember one woman was indignant. She said, you're experimenting on me. You're experimenting on me. I said, everyone's an experiment.
Yes.
This is so individualized. Everyone's chemistry is different. Everyone has a little bit of
That's
a
right.
different chemistry set. And I give you some tools, but it's up to you to trial them to see what's going to work when.
That's right.
And that empowers you because you'll know if you're feeling, like you said, if you're going to pick up this kids from school and you're going to get anxious and upset, you take a theanine or a product that I like that has 500 of GABA and 200 of theanine. And that
Hmm.
tends to be a good one. Or you get rapid active, I think there's a rapid acting L-theanine, and there's certainly pharma GABA that's chewable.
Yes.
So we,
Yes.
we have our tricks.
All sorts of products. What I tell my clients is I know as a highly experienced practitioner, I know what works for most people most of the time, but I am still giving you my highly experienced, highly educated guess as what's going to work for you. It's your job in partnership with me to tweak this to figure out what works for your brain most effectively. I don't know that because I'm not sitting in your body. Only
Right,
you are. I
correct,
can share with you my experience and my knowledge and my education, which is enormous, but I'm not sitting inside your brain.
right. So everyone can do them.
That's right.
And sometimes they're going to need more of something, but they're going to know which thing to use, you know,
That's right.
particularly the
I
quick
want,
acting ones like the GABA
yeah.
ergic ones.
Mhm. Well, but even tyrosine to give you, get up and go and energy and focus works within 20 minutes.
Yeah, it's really useful for people who have jet lag or shift workers. I mean, we do have
Mhm.
our uppers and downers. If somebody is doing
We
shift
do.
work, they can take melatonin at bedtime
Hmm.
to help restore their circadian rhythm, to help them feel sleepy enough to go to sleep.
Hmm.
And when they get up, they can take tyrosine that raises dopamine, which is for energy and focus and wake up.
Uh-huh.
So
Exactly.
that's very empowering, and it's a lot better than the substances of abuse that are available. And the whole thing about substances of abuse is our brains don't know what it needs, it just wants to feel better. We want to feel better.
That's
And
right.
people have discovered, oh, if I snort some cocaine, I'm going to feel better. Or if I take this opiate, I'm going to feel better. A different
Mhm.
kind of feel better, like whatever they feel like on opiates. And that's also variable. So
It is variable.
so we have all of these amino acids, vitamins, minerals, all kinds of things that will influence the brain. And the more we use them and the more we eat good, wholesome, healthy, whole foods, the less we're going to need the nutrients. But we have the nutrients, which
Yeah.
are more concentrated, and it gets the job done. And it does it in a really benign way.
Very benign way. I tell people I like to start with food and I like to end with food, but in the middle, we might want to use some purified food to jumpstart the system
Right.
and to get results really quickly because people are suffering
Yeah,
and need results.
for sure. And besides, there's so many, the minerals are also very important.
Mhm.
Magnesium is so vital to
Yeah,
mental health. Actually all health. People who have Charlie horses take magnesium and actually some potassium as well is
right.
often needed. Calcium, that's variable. Some people need it, some don't. For like people wake up with leg cramps. This is something I just want to put out. If you wake up with leg cramps, you start with magnesium, and it may be potassium, maybe calcium. Just experiment, see what you need, and take that before bedtime, and that will help forestall. And you won't wake up, say, in the middle of the night with it, which is the worst, waking up in the
Right.
middle of the night with leg cramps. And that hasn't happened to me in quite a long time since I've been taking magnesium and potassium at bedtime. So that's my
Nice.
formula.
Nice.
For me, it's not calcium.
Years ago, when I first started studying nutrition, it was always, you have to take calcium and maybe throw some magnesium in there. And it was 2 to 1, two calcium to one magnesium.
Right.
And over the years, it was like, well, then let's make it a 1 to 1, 1 unit of calcium to 1 unit of magnesium. And then it was, well, maybe we should substitute 2 magnesium to 1 calcium. As the role of calcium and magnesium in the body was more and more understood, we're finding that not everybody is deficient in calcium. Most people are deficient in magnesium. And we need a lot of other nutrients in order to absorb the calcium effectively. So
Right.
it gets to where it's supposed to go.
Yeah, and also the form of magnesium is important. I tend to use magnesium glycinate.
Mhm.
It also introduces glycine, and glycine is wonderful. It's calming. It's interesting. It helps to extend sleep. What it does is it actually cools the body by enhancing peripheral circulation. So it lowers the
Oh,
core temperature as the circulation goes more to the periphery. This is a nice little
okay.
esoteric fact I picked up.
Uh-huh.
So it lowers core temperature. When your core temperature is lowered at night, you sleep better. I mean,
Mhm.
we sleep better when it's cooler rather than warmer. So
Mhm.
something to be aware of. So I really like glycine. I really like mag glycinate. I mean, there's mag malate, magnesium oxide, which is kind of the cheapest form. So we find it in a lot of
Yeah.
vitamin pills, but it's not the preferred form. It's not absorbed as well.
And the problem with magnesium citrate, which a lot of people go to because it's what's out there, and it's out there in the calm drink that a lot of people drink before bed for sleep, can soften your stools and maybe give you a little bit of diarrhea the next day that you may not want.
Right. But for some people who are constipated, it's perfect.
It's
But
perfect.
this is
That's
how
right.
you actually, cookbook your way. Um,
That's right.
Speaking of which, if people are constipated, vitamin C is a good thing. And we need
Mhm.
vitamin C anyway. So the two things, magnesium and vitamin C, are really good for enhancing bowel movements.
They are. They are. May not always get down to the root cause, but while you're trying to figure out what the root cause is, these work beautifully. Yeah.
And sometimes it's just lack of exercise.
Or water.
Or water. Basic, basic stuff. Because besides the amino acids that we're giving and the vitamins and all that, we really need to practice good sleep hygiene.
Hmm.
And I don't know how much people know about it, or if they do, they don't give it enough attention. And good sleep hygiene is absolutely essential. And it's sleeping in a darkened room, having minimal or no EMFs. Don't have your phone next to you. Have it in the next room and use a different, don't even use an electric alarm clock. Use a battery run alarm clock because you don't want a lot of electricity around you or EMFs from the phone. And wherever the phone is, it should be on airplane mode so it's not pinging all the time.
That's right.
So you want to have a nice, cool, not cold, but a cool room. You want to have exercised. Also,
Mhm.
it's really useful, and this is, pertains to what you do in the morning, and that is if you get morning sunlight, if you get up, preferably you should get up with the sun. Not many of us do. I don't. Occasionally I will. But the point is,
Unless it's in the middle of winter and the sun rises really late.
okay, right. Right now I don't know about getting up that early, but it's when the first light is coming up, having
Mhm.
having 20 minutes of sunlight
Yeah,
sets your circadian rhythm.
that's right.
So that's a good thing. And as I'm saying this, I'm just sort of musing on how far we are from our natural way of living. I mean,
We are.
we are supposed to be getting a whole lot from the sun. It
We
activates the
are.
pineal gland and the pituitary. It goes
That's right.
through the eyes and into our brain. And so much
Mhm.
goes on. It activates our hormones, which are run by the hypothalamus. So all of this we don't get this in our
No,
sedentary indoor lifestyle. And
that's right.
foods were grown naturally, not with a bunch of fertilizers and not with
Right. That's
depleted
right.
soils, and that's only in the past 100 years.
Is exactly. Exactly. We need to get back to our grandmothers, our great grandmothers, their gardens, being outside. I'm not always able to get outside first thing in the morning, but I might stand by the door with the door open and just look at the sunlight, look at the light, look at my garden. And even that is just grounding and it helps, I think, with circadian rhythm as well. But the other thing highlight is part of sleep hygiene, and I think that's such a strange word to use. Hygiene when it comes to sleep. But anyway, is the fact that our bodies, we're creatures of habit and we're creatures of ritual. And having a sleep ritual tells the brain that it is time to sleep,
Right.
that it is time to secrete the melatonin and other sleep hormones, and that having a consistent bedtime ritual, no matter what it is, tells the brain and body, oh, okay, signal time here. It's time to sleep, not time to rev up and keep going.
Right.
You know,
This brings up that for a lot of people, the last thing they're doing is looking at their phone. So it is a really good idea that for the evening,
that's
speaking
right.
of our natural rhythms, we really should have dimmer lights. I don't know how many
Hmm.
of us do it. I don't. But to have dimmer light in the home,
That's
and
right.
it's like you're winding down. These are the signals you're giving your body. It's getting to be time to sleep. So you stop using your electronics. You're not getting from which you get the blue light that interferes with sleep. You actually are telling the body it is time to wind down. It's really hard to sleep when you're just getting off of electronics. You're fighting it, and it's not physiologic. We're trying to move into a more physiological, natural rhythm, which unfortunately we have to recreate. It's not part of how, like in the blue
No,
zones,
no. We have to work hard at it now.
we have to work hard at being natural.
Yeah, yeah,
It's
yeah.
a little crazy. 'Cause I keep being drawn to live. I live in the city. I live in
Uh-huh.
Los Angeles. Um, but what I really long to do is have a less urban place where I'm living, where I'm either growing my own veggies or they're very close by. I know where they come from. They're
Hmm.
fresh. I mean, we have farmers markets. That's great, but they're not, I don't know that they're always that fresh. They tend to get old fast. Um,
Right.
I want to have my very own, or where I know it's controlled and natural. We don't have any unnatural fertilizers, pesticides, herbicides, and anything. The organic is really organic.
Hmm.
I mean, tomatoes grown that way, you really know those are tomatoes. By the way,
That's right. Tomatoes and apples.
I actually found amazing tomatoes at Costco
Did you really?
from Stratford, Ontario. And
Okay, so
on the
Costco
bottom,
tries to go organic quite a bit.
what's interesting is it doesn't say organic, but they taste organic. And then I read the label and they're organic without stating that they're organic. And they're from Canada, and it may be that they have other rules about what you can say to
Okay,
qualify
sure.
something is organic. But you can tell by the look and the taste. They taste like real. When was the last time you tasted a real tomato? I mean, maybe you do because you live in a more rural area.
Yeah, we don't always get the really, really, really nice tomatoes. So we're going to need to wrap up shortly, but I know you've written a lot of books. What is the one you're most proud of or your most favorite book?
Oh my, I love them all. Natural Highs is the one that really talked about all of this, that we
It
can
did,
have
yeah.
natural highs, that we have our built-in pharmacy and we're meant to feel good and we can make that happen. And I have 8 weeks to Vibrant Health, which is more of how to do diet and lifestyle, how to clean out your kitchen, exercise, and the different systems of the body and how to approach them, from hormones
Nice.
to digestion to cardiac, whatever. So I like my books. They're on my website, cassmd.com, and they're
Hmm.
still available. You can always order them on Amazon. So I like my books. They still work. I mean, Natural Highs was written in, I think it was originally 2002. I co-wrote it with Patrick Holford, who is a wonderful nutritionist in
I
England.
just talked with him by text last week.
Well, he's really special.
Yeah.
So we have had a friendship for that long. I mean, we were friends beforehand, and we decided we were at a natural products expo, and we decided to write this book together. So we collaborated across the pond. He was
Uh-huh.
from London, me from Los Angeles, and we wrote this book. And I think it's been a perennial good
It
seller.
really has. Well, it's how I first met you. I think that's the first book of yours I ever read.
Right. I wrote St.
And
John's Wort before that.
okay, maybe I read the St. John's Wort and I read the little booklet on GABA, but that was the one that really brought you to my attention. And then I got to meet you a couple years later.
Right. And yeah, and it's been a long, long, long friendship. And by the way, I wanted to just bring up the importance of essential fatty acid in this mix
Sure.
because we need to have a brain cell that's really operating. Now, unfortunately, the standard American diet is very high in omega-6 oils and not in omega-3 oils.
Oh.
Omega-6 are the seed oils. And there we need a little bit of omega-6 in our system, but we don't need as much as we have. So the average ratio is like 40 to 1 of
Mhm.
omega-6 to omega-3, which means we're very inflamed because the omega-3s are anti-inflammatory. So you really want to have a ratio of, guess what, 3 to 1 or under. 3 to 1.
Yeah. Yeah.
Average, what we have is 40 to 1. So we need to bring that down, eating less seed oil, more
Mhm.
essential fatty acid. And then there's a product I've been working with called Balance Oil, where that actually helps to bring down the ratio because it not only has essential fatty acids in it, it also has what are called polyphenols, which are antioxidants that
Yes.
are usually removed from the fish oil when they clean out the metals. They also, there's collateral damage, which is the polyphenols that are not put back in. Well, the polyphenols are needed to keep these essential fatty acid from getting
Yeah.
rancid in us and from producing free radicals. So they're wrapped around each other in a very
Mhm.
specific formula that help bring down your balance. So I've had people who have had like a 20 to 1, 15 to 1, and then after taking the balance oil for a few months and retesting, by the way, testing, very important.
Testing. Yes.
Blood
Mhm.
spot baseline, that's how we know that the average is 40 to 1. So test again in 120 days, which is the life cycle of a red cell. And the ratio will generally be down to 3 to 1 or close to it. So we have a way of uninflaming the body using a very specific oil. So I just thought I'd throw that in.
Oh, I'm so glad you did. And if people want to learn more about that product or just understand the role of the omega-3s better, how can they get a hold of you?
There is a page that I'll just spell it out, cassmd.com, which is my website,
Okay.
CISSMD.com, slash Zinzino, Zinzino. It's an Italian.
Okay.
So cassmd.com slash Zinzino. I don't know if you have footnotes here.
Right. We will have program notes, yes.
Okay.
So
So that's
people
a
will see
way
it.
of getting hold of me and the oil and getting more
Wonderful.
information about it.
That's so exciting. And you're going to be talking about that at the conference,
I
which
will.
I'm thrilled that you're coming.
And I also am very briefly, because I know we're needing to stop this soon, I'm going to be talking about CBD
Okay.
because I became very interested in CBD, I don't know, probably about 6 years ago by now. And CBD or cannabidiol is part of the cannabis plant, but it's not the part that
Mhm.
gets you high. THC gets you high, CBD balances that out. In the olden days, when weed was weed, people didn't get really crazy from it. But these
No,
days, we have people who are getting actually psychotic from
full-blown psychotic.
weed. And this is not being against marijuana. THC does have medicinal value, has recreational value. I don't have any kind of a moral thing about it. But what we know is that the way it's being bred these days is very, very high THC, crowding out the CBD, which was the balancing.
Mhm.
We need balance. The body needs
That's
balance.
right.
So when people go off the deep end on weed, we don't say, oh, they have a weed allergy or they shouldn't use it. We just give them a bunch of CBD and that CBD will neutralize it. It actually comes, the CBD molecule comes between the receptor site and the THC. It knocks it off, and the person gets normal. And that
Good to know.
if they're going to use weed, THC, they need to have much less of the THC and more CBD, which will balance it.
Mhm.
So they'll be able to get high, but not off the deep end, not psychotic.
That's right.
That
Right.
these people, they become psychotic. They're put on all kinds of meds. They're often labeled bipolar. Bipolar is licensed to give somebody a multitude of medications to be,
That's right. Or schizophrenic.
yeah, to be on for life, which
Yeah.
is so destructive. So I would rather give them a bunch of CBD to bring them down, to smooth them out, and then they learn what their capacity is. These are people, by the
Mhm.
way, that likely already have a deficit in their own endocannabinoid system. We have built-in endocannabinoids, and
You
CBD
do.
affects the endocannabinoid system. And the endocannabinoid system is a control system. It's a communication system, very useful, and it performs a very important function in the body that we didn't even know about in the old days. I mean, until quite recently, we
Yeah.
knew about THC, but then we didn't
Right.
quite know about CBD. Then CBD was discovered, and it's been really good for pain, for stress, for digestion,
For sleep.
hormones, and very good for helping to regulate the circadian rhythm to help you
Mhm.
to fall asleep. Now, what's interesting is you can take, for example, everyone's different, but some people will take 25 milligrams and it activates them. They say, I can't take this for sleep, it's too activating. But if they take
Mhm.
50 milligrams at bedtime, it works.
Huh.
So that's how CBD works. It's the endocannabinoid system. It's pretty sophisticated, and we can actually interface with it, and we can interface with your endocannabinoid system using the right amount of CBD. And there are also some variants like CBN, which is another cannabinoid that also is more pro sleep. So if you take a CBD CBN combo, that's going to help you to sleep. I
Ah.
actually carry that on my,
Well,
I have a CBD website, which is drcass.com, drcass.com.
all right.
Two websites.
Well, thank you so much for joining us. This was very exciting. I hope all of our listeners enjoyed this and learned something. We hope to see you at the conference just a couple weeks. All right. Be well, Hyla.
Great. Thank you. This was such a pleasure.
Thank you.
Yeah, I look
Bye
forward to
bye.
seeing you.
Thank you for tuning in to Power Up Recovery with Nutrition. I'm Christina Veselak, your host, and I hope today's episode has inspired and equipped you with new insights and tools to support your recovery journey or practice. If you enjoyed this episode, please subscribe, leave a review, and share it with others who could benefit from the knowledge shared here. Stay connected with us for more episodes filled with practical advice, expert wisdom, and inspiring recovery stories. Remember, nutrition is a powerful tool in mental health and relapse prevention. Power up your recovery today. I'm Christina Veselak, and I'll see you next time.